and welcome to our Monday Minute. Today we're going to be discussing the changes in the home health final rule that will specifically impact the home health value-based purchasing model in 2025. The current value-based purchasing model in 2023 will be identical in 2024, still having a baseline year of 2022. However, when we get to 2025, there are going to be some significant changes, beginning with 5 outcome measures being removed from the model, 3 taking their place. Because of that, we will have to have a change in the weights of the individual items impacting the total performance score. The one thing that will not change at all is the HH CAHPS measures, how they are calculated, and their 6% impact on the total performance score. That will all remain the same. Beginning with the OASIS measures, the dyspnea measure and oral meds measure will both remain in the model with a slight change to the weight impact on the total performance score. The additional OASIS measure that will be added is called the discharge function score that will be based solely on the GG items, GG 130 and GG 170. There are only certain items in 130 that will be included, and we will include those in the transcript of this minute. The discharge to community measure that is currently based on OASIS will be replaced with a discharge to community post-acute care measure that will be based on claims data. That will directly impact the value-based purchasing calculation, and they will utilize 2 years of data in this new claims-based measure instead of only 12 months as the current discharge to community measure does. In addition, the acute care, hospitalization, and emergency department measures will all be removed. They will be replaced by one single measure, the PPH measure, potentially preventable hospitalization measure, and that measure in conjunction with the discharge to community post-acute care measure will make up the claims data that will be used in the model. The total normalized composite change in self-care and the total normalized composite change in mobility measures, which are currently based on the 1,800 items on the OASIS, will be fully removed, being replaced by the discharge function score that I mentioned earlier that will be based on the GG items. This value-based purchasing upheaval, for lack of a better term, it is going to be a huge change to the current model that we have and is going to need some detailed education provided to your staff prior to 2025. More specifically, we have experienced in the form of reviewing charts, etc., across the nation, that there has not been as extensive a level of education on the GG items as there has been with the ADLs in the M1800 section. We encourage agencies to immediately begin detailed education with your staff regarding the GG items on the OASIS and with your QA audit team. So that everyone is on the same page with how these items are to be completed, understanding how they will be addressed in the value-based purchasing model. In the calculation of this discharge function score that will be specifically related to the GG items, they will be taking what is said about the patient on the start of care or resumption of care OASIS, inputting that information into their algorithm. That algorithm will then calculate what the discharge status of this patient should be. Once the agency submits their discharge OASIS, the discharge OASIS status will be compared to what the algorithm has calculated that the patient's discharge status should be. They will then compare what you've said to what the algorithm said. And if your results are as good or better than the algorithm calculation, you will have a positive outcome with this GG information. I am sure some of you already have it running through your head that the algorithm needs to be developed for agencies to have access to. And I'm sure that is already happening with many of the EMR systems as the algorithm was released with the home health proposed rule back in July. It is going to be a difficult time to adjust to the changes in this value-based purchasing model, especially when many agencies have truly not emphasized the GG items as much as they should have in the past. One other thing that is a bit of an adjustment is the acute care hospitalization measure, the PPH measure, that replaced the current acute care hospitalization and emergency department measure does include observation stays. So you will have a negative impact to the measure outcome if your patient has an acute care hospitalization or observation stay during the home health stay. There is much, again, to be learned in the details of these value-based purchasing changes, and over the coming year, we will be addressing those in detail. If you need additional information about value-based purchasing or anything else HPS can help you with, don't hesitate to let us know. Have a fabulous week.